Sickle cell is a genetic or inherent condition that affects the red blood cells in a human body.
It reduces the oxygen carrying capacity to the tissues.
And then it leads to complications.
And tremendous decrease in the quality of life.
Affects different parts of the body like the heart, the brain, the spleen, and many other parts.
When it is poorly managed, can result in high burden both economically and physically to the patient and the family.
Sickle cell disease is not a global health priority because it's rarely talked about in these spaces.
Because it mostly affects people in sub-Saharan Africa.
No much attention has been given to sickle cell in Africa.
If we look at the numbers, there are millions of people across the world, especially in Africa and different parts of Asia, affected by sickle cell disease.
Because it is an assumption that it doesn't affect a lot of people, which is actually false.
1,000 babies are born every day with sickle cell disease in Africa, and half of them are dying from the disease.
Based on the prevalence and the mortality, I think it should be given more attention than what's given now.
There are no diagnostic services, the research is limited, and even in the training of health professionals, sickle cell is not prioritized.
I think as global health leaders, it's time now to do more research in this area so that we can use the scientific activism to give data to our policymakers that we need finances to fund people affected by sickle cell.
We need to advocate for diagnostic tools and treatments, and also by letting the society know about the alarming symptoms, and so that can be diagnosed and treated area.
We need to make sure that it is incorporated into policies, and we need to ensure that it is emphasized on in the medical school's curriculum.
We can advocate for the inclusion of sickle cell in primary health care, in the minimum healthcare packages, in the insurance schemes, so that we ensure equity for the health services of sickle cell patients.
So we should conduct research and make sure that we have evidence-based information.
Identify stakeholders that can support research and funding.
If we are given a chance to have a say on what conditions are prioritized in terms of interventions and implementation, I think sickle cell would move up in the priority list.
So as global leaders, we should talk more about it so that appropriate intervention should be done and we save these lives.